Black women are 40% more likely to die from breast cancer.
People don't want to admit that mammograms are not enough. It's not anything against mammograms. It's not an indictment of mammography, but mammograms are based on density. It's an x-ray.
We're not getting breast cancer more than everyone else. It just means that we're likely to die from it.
30 to 40% higher mortality is driven by a variety of things. So you got biology, right? Something is happening in the biology where Black women are being diagnosed with more aggressive subtypes of breast cancer. They need more aggressive therapies. When cancers are developing, the number one symptom for breast cancer is no symptom at all. Age to start screening is 10 years younger than the youngest person in your family who had cancer. So if Aunt Sylvia had cancer at 35, everybody needs to start at 25. Don't wait till 40. Start younger.
Breast cancer is the leading cause of cancer death in Black women in America, and 1 in every 5 Black women diagnosed will face triple negative breast cancer, one of the most aggressive and hardest to treat forms of the disease. But here's what we do not talk about enough. Fear of bad news is keeping us from making the appointment. Cost and access are keeping us from walking through the door. And when we do get a diagnosis, too many of us are navigating it alone, without the right information, without the right advocate, and without anyone telling us what life on the other side actually looks like. That changes today. Today, I'm sitting down with Dr. Monique Gary, breast surgical oncologist, chief medical officer of BEXA, and founder of Still Rise Farms, a 40-acre wellness and research incubator bridging evidence-based medicine with integrative health. Dr. Mo is here to talk about prevention, early detection, what to do when you get a diagnosis, and what survivorship and life after breast cancer actually looks like for us. This is the conversation that could save your life. If this is the kind of conversation you need in your life, subscribe and follow so you never miss an episode. This is the Lushness podcast. Let's get into it. Dr. Mo, welcome to the Lushness podcast. It's a pleasure to have you today.
It is so great to be here. It's great to speak with you.
Thank you so much for taking time. I know you're a busy lady, so it's good that we were able to get you. I'm so excited to have this conversation because it is one of the most imperative ones, especially for our community. And just in general, I'm going to start with one of the most strongest stats that I actually found on Black women. So basically, Black women are 40% more likely to die from breast cancer. Oh, goodness. Despite having like lower incidence rates. That means we're not getting breast cancer more than everyone else. It just means that we're likely to die from it. So before we talk about screening and treatment or survivorship, I just want to answer a question that I think Black women actually deserve in this. What is driving that gap and why is it not closed?
That is $1 million question. And I'm glad you asked it. And I think we're all asking it, but I think the data is showing that it's not just one thing. And that means that we have to target all of these different areas. So when we talk about Black women and breast cancer, 30 to 40% higher mortality is driven by a variety of things. So you got biology, right? Something is happening in the biology where Black women are being diagnosed with more aggressive subtypes of breast cancer. They need more aggressive therapies. They're more likely to recur. There are things that are at play, like social determinants of health. We talk a lot about what those determinants are and, food access to care, access to clean water and fresh air and green spaces. And, the stress and the impact just of things like structural racism, right? The impact at the very cellular level. And then when you look at the inequities in access to treatment and utilization of treatment. So there's a lot of different things at play. But what it amounts to is that we get diagnosed younger, right? So that means that the cancers are more aggressive. We're less likely to get screened for it. It means we need things like chemotherapy and we're diagnosed at later stages. And then when you couple that with an aggressive type of cancer that is, it's rampant through the body, all of those things create a perfect storm. A young person, more aggressive cancer, a doctor who's not aware, right? Access issues. You're not getting offered the most aggressive types of treatment. You're not getting offered those clinical trials as frequently as, And it all creates a perfect storm for higher mortality.
That's really sad to hear, but we need to know this, right? So we need to be able to understand that some of those key factors outside of genetics, sometimes the things that we cannot control, but the things that we can control, again, it relates back to our lifestyle and what we have access to. So my
Mhm.
question is this, when we go in for our mammograms, why is it not enough? Why
Mm.
are mammograms not enough for Black women?
Oh, I love this question. And people don't want to admit that mammograms are not enough. It's not anything against mammograms. It's not an indictment of mammography, but mammograms are based on density. It's an X-ray. And when you look at the amount of breast density, on average, Black women may have up to 30% greater breast density than white counterparts, which means the glandular stuff, the stuff that shows up white on the screen, right? So you're looking at this screen, and for a radiologist, there's a lot of static or snow on the screen. Remember those old TVs, the big console my grandmama had one, right?
Yes.
The more static on the screen, the harder it is to see the picture. So that's one reason, because the density could be greater. Secondarily, we have to be offered 3D mammograms. There are still places in this country that are only doing the 2D mammograms. And what I mean by 2D, I mean one view top to bottom, one view side to side, and that's it. The new mammograms move layer by layer. It's like slices through it's like a flip book, forwards and backwards, up and down. And that helps us to see through the density. The last thing is that when there's additional imaging required, let's say you have dense breasts, 48% of women have dense breasts. You need something after that. And we're not being told we need an ultrasound. Insurance isn't covering that ultrasound or that MRI. We don't know the family history. We didn't start screening young enough, too, right? We'll talk about that later. But there are a lot of issues as to why mammograms just aren't enough. And when we do see something, we then have to say something. We got to get that follow up. And that's where we lose people sometimes.
It becomes a tedious runaround, especially if you're saying that we're not getting those 3D imaging of our breasts, and that's super important. But then we don't know to ask for that. We don't know that this is not sufficient enough. We're thinking because we do our annual mammogram, we're great. We heard what we need to hear. I'll even put myself in there. I take my annuals, and I believe they found a fibroedema. Did I say it correctly?
The fibroadenoma. Yep.
Fibroadenoma. They found a fibroadenoma, and it's things like that where I'm just thinking to myself, okay, if I didn't go and get the sonogram on top of the mammogram,
Right.
which I had to do a double, even though they asked me, did I have dense breasts? And I said, it was mostly fatty tissue, but I still requested the sonogram just to double check on
Right.
on another layer. And I think sometimes we forget that double and triple checking is something that we do need, especially with how rampant. And I went based off of my mother's background because they had found something. And once I knew that, I just got on it immediately. I was like, okay, but it wasn't cancer, but
Mhm.
just the scare for her, I remember at a young age. And then I knew, like, okay, let me continue to check. So that leads into my next question. What is happening inside the body when it is starting to form? How does it take set? Like, what is starting to happen when breast cancer is forming? We don't know that the lump is developing. It is there. Tell us what's happening.
You kind of hit on something, right? Which is that you went that extra mile and you got additional imaging that picked up something that maybe wasn't seen on the mammogram. And when cancers are developing, the number one symptom for breast cancer is no symptom at all. No symptom. And it's why screening is so important. Now, when you're young and too young for screening, which, we'll talk about in a little bit, what are you supposed to do, right? Because it's not like you're going through routine surveillance. But when we do get that mammogram and we see dense breast tissue, we say, okay, we're okay this year. But at the cellular level, what tends to happen, and this is a generalization, right? Because this is not a scientific audience, but what happens is that normal cells lining the breast, meaning like the milk ducts, I use the analogy of a paper towel roll lined with bubble wrap on the inside, right? Those are the cells lining our milk ducts. Those cells become abnormal. That bubble wrap, all of a sudden, it looks different, right? It's popcorn. It looks very odd. It doesn't look like the typical packing wrap. And then all of a sudden, that popcorn keeps popping, and now the duct is full. And eventually, that duct breaks open. And so all of this stuff happens at the cellular level before we can even see it on imaging. And it's why year over year, we've got to keep up with those things. And, to your point, of the 2D and the 3D mammograms. We're getting pretty good about making sure that almost every place has 3D, except sometimes for the mobile buses, right? Those don't always have the 3D. But now there's AI. And there's another layer of inequity, though, because when you look at who gets AI applied to their mammograms and how much it costs, well, if you got to pay an extra $75 to get AI to read your mammogram, right? You're like, okay, $75, that's gas in my tank. So I can
Right.
get to work as groceries for my family. Or am I going to get some computer to read my mammogram when the doctor said it's probably okay this year? So there's the layers of health inequity, right, that contribute to these things.
Wow. Yeah, I feel like I'm not really sure how to heal that for everyone, and it's just hurtful to hear. It really is, but I think what the underlying message is, double check, triple check, just get checked. Get the process started. And I think that a lot of what you're saying is what I've been just researching, not based off anyone telling me that this is what's going on or go ahead and do it's just really going off of gut instinct and really advocating extremely hard for your health.
Mhm.
Because when you have family, when you have children, you fight harder because you want to be here for them. So
Yeah.
I think you just even saying all that not only confirms that I feel great that I fight so hard in these rooms for, checking and all this, but even the women that don't have access, that's where I created all of this so these women have the opportunity to hear from you,
Mhm.
especially if they don't have access. So that leads into my next question. When you're not feeling anything, when you don't feel a lump, and you are getting your testing done annually, right? What are some of the key things that you can do for breast health in general? I think just even understanding how breast health works, how we should be taking care of ourselves. I would love to hear your thoughts on that.
Okay. Oh my goodness, so much. And I applaud you for this platform
Thank you.
and for bringing this to light because what happens from this, right? The knowledge is power, and in that power we take action. There are things people can do when we talk about access, and maybe we'll talk a little bit about legislation and advocacy and all those sorts of things, but this in and of itself is a form of advocacy. To that point, right? Advocacy is action. So self-advocacy looks like I need to know my body better than anybody else.
Right.
It looks like I need to be empowered, which is exactly what you said. I did this research not for anybody else, but for me, for my family, so I can be around. So, knowing your breast and understanding the changes in your breast isn't something a lot of doctors talk about.
Right.
They're not trained in it, unfortunately, right? We tell women that, we tell everybody, oh, look for melanomas, check for skin cancer. And here we are. Is this a melanoma? Never seen one before. But then we tell women, don't feel your breast, right? We tell doctors, don't do the breast exam. And every second person has them. And so, starting with knowing your breast, what's normal for you. And I always tell my patients, we did this wrong. We told people how to do the breast exam the wrong way. We said, check for lumps. Breast exam, check for normal. What is your normal? Because in most women, young women, Black women, whatever, inherently lumpy breasts. And so it's important for us to know, okay, you know what? This one's a little bigger than this one. All right, I always feel lumpiness over here. And then when I check the other side, it's lumpy in the same places. Symmetry is important, right? Those nipples, they may be doing their own thing. They're twins. I say they're twins, but they're never identical.
Hmm.
But the nipple should be out. If one nipple starts going in, if the skin gets thicker, if all of a sudden you lift your arm and you see a little dent where there wasn't one before, we got to notice those changes. So, knowing your normal is probably the most important thing that Black women, especially, can do for their breast health. Two, knowing that breast exam and doing that breast exam. And we call it self breast awareness because it means knowing it on the first, means knowing it on the 15th. If there's a 31st day of the month, you should know what your breasts feel like on the 31st before your cycle, right? And then it gets lumpy and gets full and gets tender, and then it should go away, right? A week or so after that cycle, those lumps and those changes are going to start to go away. And so understanding that process helps us not to be afraid of our breast health. And then the last thing I think is thinking about things like, making sure we have good fitting garments, making sure we don't put our cell phones in our bras and things, and like being mindful of the fact that, we have to care for our bodies as a whole because the things that can cause breast pain and all those fibrocystic changes, stress, anxiety, fatty food, salty food, right? So managing what we eat, what we put in and on our bodies are things that manifest in our breast health as well. So, think about breast health as an extension of our general wellness. And I love how you frame that breast health, right? Because the majority of people don't have cancer when we go in for our exams. Only maybe 8%, which means 92% of us are doing just fine this year. And why aren't we celebrating that? Why aren't we focused on that?
No, I agree with you 100%. And I believe wholeheartedly that if we're going to go in there and we're going to advocate for our health, right? I use breast health because everything in the body needs maintenance. And
Mm-hmm.
if we're going to talk about spinal health, brain health, any of those things, you
Right.
attack it as a system, right? You make sure that every part of your body is seen for and cared for because these are the important parts of us as women, right? So
Right.
that's why I always frame it as health in general. Do not think you're just going for, a pap smear and you're just thinking, oh, I'm just getting, no, think of it as reproductive and vaginal health. Like,
Mm.
put it all together because when you start talking this way to the doctors, they know they're not talking to a slouch. And I'm telling you,
Right.
I went for an exam and the woman who was doing radiology on me, she asked me, she said, "Are you a doctor?" And I said, "I am not a doctor. I just know what I know. I've done my research and I talk to you guys all the time. So it's changing the conversations in the room. So if we're
Mm.
going in and we're just talking about, I want to stay on top of my breast health. This is what I've noticed. This is what changes I'm seeing. They look at you completely different. And I think as Black women, once we're armed with information, we're coming in swinging differently. We're empowered more. We're saying things that you're just like, whoa, I didn't expect to get that question. And I love when the doctors sit and look at you and then they're just listening to you and they're just shaking their head like, yeah, nope, that's,
Yep.
and I love that. And that's what I want for every woman, every listener that's listening.
I love that. And when I have patients who come in and they're like, okay, but my normal is this, and I usually this, and this, or you know what, I was reading about this and I wanted to ask you about this. I mean, I get so excited because I'm like, this is a patient who is thoughtful about their health. They're listening, they're learning, they're figuring out what's going on in the world. They're keeping up with current, not just current trends, right? Not social media, TikTok trends, but like what's real as far as their health, and they're invested. When people come to me and they've got their questions, that tells me they're invested in their health. But the thing you just said was that I shift that focus away from detection or whatever it is to health. That's what needs to happen because we don't really make early detection of anything very attractive, right? Let's be honest. Something's got to get smashed. Something's got to get stuck somewhere, up in your hoo-ha. You got to poop your brains out before you can, like, it's not a fun thing to think about this cancer prevention or cancer detection process. But when you flip that and say, let me just make sure my colon's healthy this year. Can I just make sure that my love below is healthy this year? Let me make sure that I want to check and make sure my breasts are healthy this year. It changes everything in your mind about that. And that's what I hear you say it. And I mean, that's a movement. That's a whole show in and of itself, right? Shifted from illness and an illness mindset to a wellness mindset, girl.
Yes. And I'm telling you, we did an episode with another one of my favorite doctors and she said it. We don't talk enough about generational health.
Yeah.
And I think that is one of the most powerful things that she said during her interview. And
Mhm.
that's why I feel even about our breasts, especially knowing what we know, armed with these numbers and definitely taking control. So that definitely leads me into talking about something very specific to Black women. And I
Mhm.
think that it's something that, from what I read, scares a lot of Black women, which is that I believe it is the triple negative breast
Mhm.
cancer. I wanted to talk about that because I know that it profoundly impacts our community the strongest. So, can you shed a little light about it? Why? I know that I'm not 100% sure if everyone understands why this happens, but
Sure.
we've got the expert on, so you can definitely let us know.
I love it. And you're right, because the first time you hear triple negative shouldn't be when a doctor's telling you you have it, right?
Yes.
That is huge. So we describe breast cancer. Breast cancer is not just one disease. There are different parts of the breast. So there's ductal cancers that start in the milk ducts that carry the milk to the nipple. There's lobular cancers like my grandmother had, invasive lobular. They're the lumpy, fluffy parts that make the milk. And that kind didn't show up on her mammogram, right? But when we talk about these cancers, we look for what's on top of the cancer cell or what's driving the cancer to grow. And I tell my patients, you got to think about it like this: something treats the breast and something treats the rest. As a surgeon, I treat the breast, either remove the lump or remove the breast. And we talk about what needs to be done there. But how do we treat the whole body? Well, that has to do with medicine and the medicine we can give you. If estrogen's driving a cancer to grow, we can get rid of the cancer and block that estrogen so it doesn't grow back again. And we can do that with a pill that blocks estrogen called tamoxifen, especially in young women. When those cancer cells don't have those little receptors or stations on them, we call it triple negative. And there are 3 stations. And I say it's like toll booths on the turnpike, right? You got toll booth 1, 2, and 3. And we look under the microscope. We do a little microscope slide and we put the dye down and see how many of these cancer cells are using estrogen. If they're using estrogen, you can maybe get a pill and not need chemo, right? But it's like the difference between having toll booths or being in that easy pass lane. You know how you got the little easy pass and you're flying right through? Those cancers don't have toll booths on them. They're very aggressive. They're going right through the tolls. They're growing faster. You got to send a state trooper, right? Because you're not stopping giving your $1. And so we explain these cancers in terms of the receptors or the stations that are on them, and it helps us to know what drives them. So in the instance of triple negative cancer, we don't know all of the reasons and all of the drivers. And that means we have to give more aggressive therapies because they're going through faster. The cells are replicating faster. They're spreading faster. And that's the kind that Black women are more likely to get.
Yeah, that's what I heard, and it's so scary to hear that. So my question is, can early detection as far as your annuals stop that in its track, or is it something that develops at the drop of a dime? Like, how does that even happen? I think that's more so what we'd all like to know.
We all would like to know that. Yes, we would. And the answer is we don't yet know. But what we know about triple negative breast cancer is that there are other things driving those cells to grow. And we're learning that there's new targets that we can target with medicines that are a little bit less toxic. But the question of, is screening enough, especially for Black women and especially for triple negative? Those are the kinds that tend to be more related to mutations that you inherit from your mom and dad. Hereditary mutations, right? So think about, for example, the BRCA genes, the breast cancer associated genes. You heard of the BRCA1 and 2 genes?
Yes.
Angelina Jolie, for example, a very common example. She inherited from her mom, and then she did her double mastectomies and she was on the cover of Time. But did you know that Richard Roundtree, did you know that Matthew Knowles had breast cancer? He
Yes.
has a mutation that he could then pass on to his kids. So those mutation carriers are more likely to get this aggressive type because something's wrong in the signal that says, hey, stop abnormal cells from growing. And our body has these checkpoint systems so that if something's going on, we should be able to stamp it out like our immune system, right? But when you have these mutations, your body doesn't always do that. And so one mistaken cell makes 2, makes 4, makes a million, and now you got a problem on your hands. So getting genetic testing, especially when we know there's triple negative breast cancer in the family, is super important. And the other thing, one more thing for screening, is that the age to start screening, everybody says, oh, start at 40. Age to start screening is 10 years younger than the youngest person in your family who had cancer. So if Aunt Sylvia had cancer at 35, everybody needs to start at 25. Don't wait till 40. Start younger.
That's so powerful. Wow. That's really powerful to know. That's really, really good information because honestly, that was going to be my question. How early should we be looking at this? And if you're saying that even something as critical as this, and you start as early 10 years prior, that's really something. And it's interesting because when my mom had found something, at the time when she had went, I'm thinking, okay, I'm 40, now's the time. But God forbid it was something stronger or
Yeah.
it was actual cancer. And I may have been too late.
Yeah.
Just not, and this is something no one is telling us. No one is having these kind of conversations with us and saying, hey, and we don't think to put that down, especially if we're not going to test, because we're thinking these illnesses come with age, and it is not. This is why we're hearing colon cancer is younger. This is why we're hearing all these cancers are coming at like 28, 30, 35,
Mhm.
because we're not paying attention to family history. Our lifestyle in America, especially high stress, high cortisol, high everything that's negative to our cells on a cellular level is happening. We are not paying attention because what are we doing? We're working to pay the bills. We got to get the kids. And we're neglecting ourselves. And as Black women, because we're so much to everyone, we
Yes.
we put our health on the back burner, not knowing we're late. to our appointments for ourselves.
We're climbing that corporate ladder, right? We going for that promotion. We finally got an opportunity. We're in the room, right? We're at the table. We're in the room, and there's no way I'm taking time off to go get that thing when I got to go to this presentation. I need to go to that conference. I'm working on my PhD. Like, sisters are doing it. But you said something, you said generational health. And the thing is, generational wealth is generational health, and generational health is generational wealth, because what are we passing down to our families, right? That knowledge, so that I hear you talking about this, knowing that family history. Had we known, we might have done something different. And so these conversations are really helping us to, demystify this and destigmatize this. It's not trying to get in your grandma's business to say, hey, grandma, tell me a little bit about your health history. And if you have to frame it spiritually, I say, listen, Nana, tell me about a time when God got you through something really challenging, and let her go. And she will tell you everything, right? Where it's not just trying to get into her business of what happened in her health, but we need to know these things, because that's the wealth. Because when I know that, I need to start screening early. Same thing for colon cancer, 10 years younger than the youngest person in the family. So if we don't know what's in our family, we're missing out, and we're missing early detection. And to your point about, you didn't know and you started at 40, or the doctors think the same thing, that cancer is a disease of aging.
Right.
And it's why they send these young girls out of the office, and it's why they come see me. I'm outside of Philly, right? I get young women who come from the city all the time because the doctor said, oh, you're probably too young for whatever. You're not. Cancer knows no age, and not too young for cancer.
No, I've been dismissed multiple times, and had to find a doctor that looked like me, that broke it down. I can tell you how many times I've been recommended hysterectomies. I can tell you how many times I've been recommended things that I'm just looking like, what?
Right.
And then by the time I get to a doctor who understands that we have, better information, oh, they break it down for you, and they let you know what you could have done or what you missed had you had listened to that recommendation. So it's important to triple check and definitely do your research. So this leads into my next question, which I am enjoying this conversation so much, because it is literally so empowering in hearing all of this and just getting your confirmation on things. So my next question is this: a woman gets a diagnosis that she has breast cancer. What should be her steps? What should she do? This part is super critical to me, because I want any woman who's listening to this to know what their chances are, where they should begin, and how to fight through it.
This is it, right? This is the toolkit. All right. So the first thing, if you get diagnosed with breast cancer and you find out, you open your portal in your MyChart or whatever, or you get a voicemail, who knows how people find out these days? It's so impersonal. But the first thing you should do is breathe. The first thing, breathe. Right? Because that breath centers us. That breath reminds us that while we are yet breathing, there is still hope. There is still opportunity. There's still time. And women need to know, okay, don't panic. I'm not in, because it's like a bomb goes off. Patients say over and over again, as soon as you hear the word cancer, you didn't hear anything else after it.
Yeah.
And you see people talking, and all you see are their mouths moving. And you didn't get that. So the second thing you do is you may want to phone a friend, right? And find somebody who can be an accountability partner to you, because the studies show that when you go to your doctor's office and you bring somebody with you, that doctor's more likely to spend more time. That doctor's more likely to answer more questions. That person can ask the questions that you wrote down because you did your research. But when you're sitting there in that gown with your butt hanging out, you're like, okay, whatever the doctor said. And then you leave and you're like, oh, but I had questions. So that person can be a person who can help to write down questions, answer questions if you perceive something. Because sometimes we perceive things when we go to a doctor, like, did that doctor just say that, they didn't think I could, whatever. And that person can say, doctor, what we heard was this. Is that what you meant? And it gives a chance for clarity, right? For a conversation, so that it's not just happening to you. So remembering that you are a partner in this, an active participant in your care. Nobody should be talking above you. Nobody should be talking about you, nothing about you without you, right? And that you are in this. You tell your doctor and you show your doctor that you're in this, and that you're not just letting things happen to you, that you have questions, that you deserve answers, that you know what? I didn't understand that, doctor. Can you explain that to me in terms I can actually understand? Or what I heard you say was this. Is that right? Making sure you have somebody accountable. Doing research, yes, but be careful where you do your research. Social media is not the place to go for your cancer diagnosis, because I tell you what people do. They start calling family, friends, and well, so and so had this and she didn't need chemo and so and so did, and then they died, girl. That's not even your story. Their story is not your story. Every cancer is unique. So remembering that and keeping that in mind when people tell you things and what you should do is based on your plan with your doctor, your faith, your family, your unique situation, not anybody else's, because there are different subtypes of cancer. So you get that diagnosis, you got your people, you look up online. American Cancer Society is a great resource. Touch, the Black Breast Cancer Alliance, is a great resource for Black women. They have question guides. Tyre Lily Foundation, right? You can go to these sites and they'll say, hey, here's some questions you can ask your doctor. So you go and print off that list of questions to ask your doctor. What's my type of cancer? What about clinical trials? What about genetic testing, doctor? And then you go to that doctor and you listen. You let them examine you. You find out who's my team, because it's not just the surgeon, right? My job is to surgically remove cancer and to help coordinate that team. But there's a doctor who treats cancer with medicine, a doctor who treats cancer with therapeutic x-rays called radiation, right? And don't just start denying and refusing everything, because that we do see that I want to do holistic. And I say, okay, and I got a 40-acre farm. I'm all about holistic. But tell me, what's holistic to you? Well, CMOS. Okay, but how much CMOS is it going to take to get rid of that cancer, sister? Right? Can we talk about CMOS to boost your immune system while you yet do some other things that can be helpful to you? And so taking it all in and not just writing it off because, the doctors or the whatever, like that mistrust comes in strong. And even having a Black doctor sometimes doesn't undo that. I have to spend a lot of time. Patients, as soon as I say chemo, arms go up. And it takes another 45 minutes to get those arms down, get that shoulder down, and let's talk about what we need to do so you can be alive, so we can keep you alive.
Right.
Yeah, so an open mind is important. And then your faith. For a lot of people, faith is a really important part of their journey. So whatever gives you faith, what gives you hope and support, lean into those things.
Yeah, I actually felt myself getting emotional hearing you say this, because I want women to understand that there is hope and survivorship is definitely still on the table. So I want to talk a little bit more about that as well, after treatments, all of those things, to give these women hope, because I know what that feels like when you see, like, even when they found that in my right breast, everything stopped. I'm like, what do you mean you found something? I was expecting to not hear you
Your
found
mind's
anything.
spun out of control, right?
That's exactly where my brain went. I automatically went to my children immediately. I wasn't even, and my husband, I wasn't even thinking about anything. And you're so right, because that is dum da da dum. I found something. They found something. So let's talk about what that survivorship looks like,
Mhm.
what that should feel like. I've seen so many women beat breast cancer. They do their walks. They make it their life's mission afterwards to help other women. But I'm telling you, the emotion got to me because I love Black women so
Yeah.
much. And I just hate the way the medical system treats their symptoms. But I also want them to understand the surviving part, the thriving
Right.
part, the living part that's coming. I just want to shed some light on that.
I love that question because, cancer for Black women is always described in terms of our mortality and never in terms of our survival. And we are living longer and longer. We are overcoming, right? When you look at the rate of overall, the rate of survival for breast cancer is better than it's ever been, right? Now, we still, as Black women, we got a ways to go. We have a higher mortality rate than white counterparts. But in general, folks are living longer with breast cancer. So I tell patients survivorship, number one, it starts at day one. From the minute you got that diagnosis, let's start talking about it, because it's not a destination. It is a journey. It's a walk for the rest of your life. This is a thing you're going to overcome. And what I mean by that is every headache, you're going to be like, oh, is that a something? And so we got to talk about stress management more than ever before, right?
Yes.
We got to talk about, at the farm, we call them your meals, your movement, your mindset, the 4 M's, and how it impacts the medicine, because all of those things come into play. I tell patients, I do you no service by removing your tumor if we haven't talked about the other cancers in your life. So let's talk about, what are the other cancers, right? Is it the toxic job? Is it a relationship? Is it the kid that lives in the basement and needs to get a job? Is it the things, the negative self-talk, right?
Mhm.
About you and the things you don't like about your body? Because cancer doesn't make any of that stuff better. And you finish and you ring that bell. And we're like, great, go and put your tutu on and go run down Broad Street. And, love yourself, love your body. You didn't love that body before cancer. So let's talk about that, sis. Right?
Oh, love
And
that.
so survivorship is an entire process of the living, surviving, thriving, and managing all of the aspects that you can after and beyond your cancer treatment. And so that could be cardiovascular. You're short of breath right now in your heart because of that chemo, right? Let's talk about cardiovascular physical therapy. Can we put you in some cardiac PT, right? Let's talk about getting those steps in, and we're giving you a pill that makes your joints achy. And it is so very real. And for so long, doctors like, just take some Advil, or just take some Claritin. And now we know there's a whole science behind survivorship and an investment that has to be made. So when you analyze, and this is going back to when you get diagnosed, when you look at your cancer centers and places where you go, ask about what survivorship tools and resources are available to me. I understand you're going to take my cancer out, doc. I love that. But then after that, who's there for me? What's my team look like? Right? Because survivorship is so important to help people feel like they're managing their life outside of their cancer. And that's what I want Black women to really lean into. And a lot of that has to do with first sitting in the space that allows you to be afraid, that allows you to be vulnerable, that allows you to say, you know what, I'm stressed and I can't take on one more thing, and I'm not going to do that. I'm not going to set myself on fire to keep anybody else warm, because that's what we do, right? Even before cancer. And then even during cancer, we're managing everybody else's feelings and emotions and trying to make sure everybody's okay. Sis, I need you to make sure before you put on that tutu, before you start that nonprofit, before you're out there waving the pink banner, sit with yourself, get some therapy, get you some rest, get you some good nutrition, right? All of those things are part of survivorship. And then the outward manifestation of what we're doing to empower our sisters. And we could do, two things can be true at once, as they say, right?
Yes.
We can do that. But I just see so many folks who are broken and inside, and they're still depressed, and they're really grappling with what happened to them and to their bodies. And there's so much support out there. So I say lean into it. Ask the questions. Survivorship questions should be right there. Number 10, about your chemo, about your radiation. Number 11 and 12, survivorship.
Amazing. 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 Because I can tell you, just dealing with that stress management, right? During, after, I mean, even saying to yourself, because sometimes that little voice will creep in, like, what if it comes back? What if you're not, what if you're not doing the right things and it could possibly come back? I didn't change my lifestyle prior to this. I didn't do any. These are
You
the
didn't
things.
cause it though. And that's the thing. Like, we put
Right.
so much blame, especially in Black women. I was on a panel once with a doctor, and he was like, yeah, these Black women, they're overweight and they didn't breastfeed and da da da. And he was like rattling off the list of why cancers were their fault. And I said, I have patients with 2% body fat who drink alkaline water and they're plant-based, and they still get breast cancer. Like, stop this. Right, but we put it on ourselves too. We internalize that. We didn't change everything. You're not going to change everything. It's a gradual process. And if we didn't have the tools to manage stress before cancer, we're going to be really stressed out when a cancer diagnosis happens. But it's a good fork in the road. That's the pivot. That's the pause. And you pause and you figure out, what are those tools that I need? Because I'm not living like that. Whatever happened in the past, happened in the past. But moving forward, I'm managing my stress in these ways. Moving forward, I'm moving my body in these ways. I'm being intentional about what I put in my mouth. Even if I'm stress eating, maybe I'm stress eating celery. Like, we got to figure out some new ways.
Right. No, it's the truth. And that's exactly what I was waiting to hear you say, that, because we're always hearing all the bad and negative things that Black women do or what we're struggling with. Heck, even in this entire podcast, I'm always starting with what's impacting us, what we're not doing, we're not moving enough. We're always hearing that. But in this particular situation, it is all about doing an audit where we can, and just making those small changes and managing what we can through that process. That's just going to make it so liberating at the end. And I feel like it is another opportunity, another chance to do it right, however you see fit. Whatever that plan was, it didn't go anywhere.
Yeah.
You just had, like you said, a fork in the road where you made a wrong turn, not you per se, but a wrong turn happened. I should say it that way. The road is still there. And I think that that is one of the most powerful things in this conversation. Please tell me, what do you normally find with your Black women patients when you find out that they have breast cancer? What is something common? What is something that you hear frequently and you're like, this is something I wish Black women knew? what would that be?
Let's see. Ooh, that's a good question. Common things that I hear, I'll start with not what I wish that we knew. Yeah, maybe I'll frame it that way. But the first thing I hear is I need to pray about this, right? I need to ask my pastor, right? Because we're faith-based and we're spiritual people. And when that pause becomes too long, I call my patients and I'm like, listen, sis, faith without works is dead, right? Like that's biblical. So what's the work, right? We doing the faith part. I understand we're praying about things, but what does that faith compel us to do, right? Because our faith tells us we can do hard things. We can do tough things like chemotherapy if we have to, right? We can do hard things like radiation, like surgery. And then I hear, well, I'm going to do this naturally. And I'm a big fan of holistic and, integrative approaches to cancer, but I think it integrates, it complements, it doesn't replace. And so when I see people make that choice that they're not going to go through treatment and they're going to do holistic things, I try to understand and respect their point of view, because what happens is doctors dismiss. They're like, okay, well, if that's what you're going to do, then go on out of here, right? Get out of my waiting room, because I got a bunch of people who actually do want what I have to offer. But it's not that. Right? We want people to listen to and understand that we have always believed that there is healing in the land and that food is medicine. And we want somebody to validate that. So I validate that. Like, it doesn't replace. I don't know how many strawberries it's going to take to get rid of that breast cancer. The world may never know. Well, let's talk about what strawberries can do for you. Let's give you some power back, because that's really what you want. We want to feel empowered to the best that we can. So let's talk about, how is our food medicine? How's it our secret weapon in this fight? And so I pivot to make sure people understand you don't have to choose between CMOS and chemotherapy. You can do both. Both. And we talk about what holistic means, what it is, what it isn't. And I support them through that process. I hear things like clinical trials make me a guinea pig and they're going to give me a sugar pill and die. And then we talk about clinical trials and how you never get less than the standard of care. And if nobody ever mentioned to you what is the standard, then you wouldn't know. So let's pull up, what's the standard? What does everybody get? And then how does a trial give you standard plus something extra? And we talk about that, because that's a misconception. They just want to experiment on you. No, we want you to live. And when you have more aggressive types, sometimes a clinical trial might be the best thing for you because of what you have. It may give you less toxic drugs. The goal of trials is to get more personalized so that at some point we can stop getting the most toxic drugs and get the precision medicine. So we talk about those things. So those are some of the things that I hear that is going to come back. And we talk about recurrence and ways to manage that. I think, from the perspective of, Black women, I encourage them to be hopeful, because the last thing I'll say as far as myths and misconceptions is that I got breast cancer and I'm going to die. And I say, listen, you need to go to podcasts like this. You need to go to these sites. You need to hear the narratives of women who are thriving, even in stage 4. I've got a friend who's now 26 years, stage 4, Black woman. She was doing yoga in South Africa over Christmas, right? With stage 4 cancer. So don't believe everything you see and hear. If you ain't see and hear it from me, don't believe it. And if you do see it and you hear it, bring it to me and let's talk about it. Right? So having that relationship with your doctor. And the last one, I did have one more, is that your doctors aren't gonna always look like you. There aren't enough Dr. Mo's in the world, but there are some good doctors. And how do you judge who's a good doctor? Right? Is a thing that we need to suss out, because only 2% of oncologists are Black. So the chances of you getting a Black oncologist, it could be low.
Yeah, no, you're right. And I want to share this really quickly. I went for an actual visit with a hematologist, and when the door opened and a Black woman came through, I felt like I was about to scream and jump through this. I said, "Oh my God, thank you." And she laughed at me because she was like, I was like, you don't even know what you just did for me." Because it's true, you're not always going to, but it's such a great surprise when you do find out, especially certain sectors of medicine where you're like, okay, you kind of know what the standard may be, because you're not always, to your point, going to get a doctor that looks like you. But like I said before, always, even if the doctor does not look like you, if you know what you're talking about, if you come in with they know you're not a slouch. They know what you're saying. So I want to touch on something, because you started talking about holistic, and I want to talk about your Still Rise Farms, because I want to get to the nitty gritty of that as well, because I love the concept, but I'm going to let you tell it better than I can. So please tell us a little bit about your farms.
Oh, sure. So for Still Rise Farms is a 40-acre farm. We call it a wellness incubator or living learning laboratory. And it is a place where the active process of learning about healing, learning about integrative therapies happens for people who not only have cancer, but you could be battling chronic illness. What we learned was that we started this farm in response to patients who are like, okay, am I going to die? Do I need chemotherapy? And question number 3 was how do I change my life? How is food medicine? What does that mean? What should I grow? Well, what types of foods, doctor? Well, what about yoga? What about acupuncture? What about all these things I've been reading and hear about and stuff I want to do? Does it actually work? And so we created a space where people could come and we curate those experiences for groups. So it's not like a public forum yet, but it's a place where we hold retreats for cancer patients, especially, and we go over nutrition. Go in the garden. We're going to pick some things. We're coming back in and we're making, I think they made collard green wraps. And who knew you could eat collard greens raw, but it was delicious. And you made wraps from the leaves that you picked, right? We have talks about sex and intimacy and pelvic floor. We talk about nutrition, about meals, movement, mindset. So those are our pillars: meals, movement, mindset, how it all helps the medicine. Because whether you got diabetes, whether you got hypertension, you got ADHD, cancer, everybody's asking for the same thing. And so we wanted to create a space that would democratize wellness for people who need it the most. So that's what we do here at the farm. And I'm loving it. We've tripled our growing area and we are now getting to the point where doctors come and they participate more. I'm getting hopefully a doctor's retreat because we need to turn our phones off and get our feet in the dirt, right? Get our hands in this in the soil. But it's a place that validates that and that shows how the medicine contributes and also the science of nature-based therapy. So people who are battling their side effects, let's say joint aches, right? How can stretch and yoga help that? How can breath work support that? And it puts the power back in people's hands who feel really powerless because something happened to them that they couldn't control. But what can you control? How you move your body, your thoughts, getting rest, managing stress, how we move our bodies. All of that's within our sphere. And those are the things that reduce the risk of recurrence. So you mentioned young people getting cancers, right? All those things are implicated in why young people are getting cancer. So if we start teaching kids how to manage their stress and how to do breath work and how to move their bodies and what foods to eat, we're going to see less cancer, hopefully, in our communities.
That's exactly what we want. We want to be able to pass down that information to our children. I know I do. I know most mothers want to. I think this is one of the most powerful conversations that I've had. And my question to you is, if you could leave any parting last words from Dr. Mo, what would it be?
The parting words, from my standpoint, one, talk about these things, right? Because knowledge is power. And when we know better, we can do better. When we know what runs in our family, we can bring that up to our doctors and we can get screened for those things earlier. So that's one thing. Talk about it with your families and take the stigma out of it. I have a friend and she said she will hold the Thanksgiving meal until everybody tells their blood pressure, their blood sugar, your PSA, whatever numbers you got. She wants to hear that we're on top of it, but it normalizes the conversation on health. 2, know your body. And if you don't, go to somebody who can teach you. I don't know what I'm feeling, doctor. Can we go over this? Right? I'm not sure. When I get these headaches, does it mean my blood pressure is high? Well, let's get you a cuff at home and let's figure it out. But learning your body, you got to be the CEO because the doctor's only going to say, well, how long's that been going on? What makes it better or worse? When's the first time you noticed it? And if you don't know your body, and you're, a little while now, you got to help us. Help us help you, right? So be informed and be invested. And then the third thing I think is, there is hope. And don't just feed into the narrative that everything about Black health is poor. Black folks are tuned in, tapped in, turned on to our wellness like never before. And you can get right in on it. That's our birthright, right? Our birthright is good health. It's good mental health. It's good physical health. It's good financial health. It's good sexual wellness. And I think reframing that for us is so, so important. And lastly, get your screenings. Don't put it off. Don't be like, oh, you know what? I feel good and I don't need no bad news. It might not be bad news, but we won't know what it is. And we can't find it early if we don't go in and get those screenings. So those are the things I want people to focus on, and just be optimistic and be hopeful. The history of our country, right? We're 250 years in. Black doctors have been leading the charge for almost all of that. So our health is so vital and important and it's essential and it's not a foreign or a new concept. Wellness is not new to us. It is in us. The answer to cancer is in our genes, right? Our wealth is in our hands. Our health is in our hands. And I want people to really know that.
Dr. Mo, you are a blessing. Thank you so much for your time. Thank you for sharing this information. You've not only educated the audience, you've educated me, and you've also inspired me to keep doing what I'm doing because these messages are so powerful. I'm tired of the narrative. I find the science, I bring the science through statistics, through studies, but to hear it coming from you that we're owed so much, and rest was another one that I wanted to mention. We deserve
We do.
rest. We
Yes.
really do deserve it. And this was a phenomenal conversation. I hope women feel stronger about where to find the resources, how to advocate for their breast health, and how to continue to understand that even if you get a diagnosis, it's not a death sentence. And
Hmm.
I would challenge them to start planning their life after breast cancer.
Ooh. Thank you for this platform because you're right. It is so powerful and so informative. And, it is an investment like that rest is revolutionary. It's an investment in our wellness and our well-being. So I just encourage us to really get excited about wellness and not just about cancer detection, and really lean into it. It is for us. And right now the wellness industry looks like it's for a lot of other people that don't look like us. But I'm here to tell you that it is for us. It is in us and it is owed to us.
Thank you, Dr. Mo.
Thank you. People can follow me on Still Rice Farms on Instagram and all social media outlets. Dr. Monique Gary on all social media outlets. I answer a lot of questions and we do a lot of education, for our communities on cancer, on early detection, on nutrition. And I just thank you again for this platform.
You're so welcome. Thank you.